ahead from California, a look at Latino senior citizens leaning more on long-term care facilities.
You can have a home-like environment, but yet still be able to read the newspaper with your coffee in the morning and have those little comforts, but then you can have a big fiesta feast with a mariachi band.
Now, a different look at providing care to those in need. It's part of our occasional series on aging and the challenges of providing long-term care. Tonight, we focus on Latinos, who will comprise 20% of the elderly population by the year 2050. The NewsHour's Mary Jo Brooks has our report.
Listos? Ready?
76-year-old Nicolasa Romero still gets teary when she talks about how much her life has changed after suffering a stroke 8 years ago. A legal resident who immigrated from Mexico, she had been living with her daughter in suburban Los Angeles, but the stroke forced her into a long-term care facility.
Because of my stroke, I can't walk. I can't move one arm. My daughter lives on a second floor and I couldn't go up and down the stairs anymore.
Romero is part of a trend among Latino senior citizens. Traditionally, they lived their final years with family members who served as their caregivers. But as more and more Latino couples are working outside the home, there's no one left behind to care for elderly parents. And so, they are going into nursing homes. In fact, there's been a 58% increase in Latino admissions compared to a 10% decrease for whites.
Okay. Oh, those are good.
Rashmi Burla, who's been a nursing home administrator for 14 years, has seen firsthand the surge in interest by Latinos, although she knows it remains culturally a tough choice.
It really is not easy for families when they're touring the building and they're in tears and they're crying. And just to kind of, rub their shoulder and say, it's okay, I understand, it's difficult. We'll help you through this.
Burla is now the director of the Country Villa Plaza in Santa Ana, a 144-bed facility where 70% of the residents are Hispanic. In the past, many nursing homes haven't welcomed minority residents, but here they've gone out of their way to provide cultural amenities, including entertainment, special food, and, of course, competitive games of loteria, a Mexican version of bingo.
We get them involved, so it's not that they're just sitting in their rooms. And that's really what we're trying to aim at, is saying that, you can have a home-like environment, but yet still be able to read the newspaper with your coffee in the morning and have those little comforts, but then you can have a big fiesta feast with a mariachi band. And all of that makes a huge difference in how they feel and the happiness that they have and the comfort they have.
Romero says the people at Country Villa have become her new family, and she never wants to leave.
I want to spend the rest of my days here. I want to die here. Because when you die, you should be in a peaceful place. And this is a peaceful place.
But centers like this, which cater to Hispanics and offer high-quality care, are still far too rare. A Brown University study 3 years ago concluded that minorities, far more than whites, live in facilities that are substandard, suffer from staffing issues, and poorer quality of care. It's one of the reasons Al Mendez says he won't consider the idea of a nursing home. For more than 4 years, he has helped care for his 77-year-old father, Jaime, who suffers from Parkinson's. Jaime lives in a small cottage behind his son's house.
He's my father, I want to take care of him forever. And that's the way we were raised that way, to love and take care of each other. So he just wants us to, he's always with us.
But a year and a half ago, a social worker told Mendez that his father's health might actually improve if he spent a few hours a day at a senior health facility. Now, 3 times a week, Jaime rides a shuttle to a PACE center just 2 miles from his house. PACE, which stands for Program of All-Inclusive Care, was started in the 1970s in California.
Up for 8.
There are now 98 such centers across the country. This and 5 others in the Los Angeles area are run by a nonprofit managed care group called AltaMed, which caters to poor and underserved populations.
And open. Reaching over.
The centers accept only patients who have been certified by the state as eligible for a nursing home, but it is a day center only, so patients can continue to live at home with family. PACE centers are often located in impoverished neighborhoods, and they reflect the ethnic backgrounds of those residents. Here at the El Monte Center, the population is 88% Latino. They offer exercise and physical therapy, breakfast and lunch, numerous social activities, and full medical care.
Aquí la atención es muy buena.
I like coming here because I get lots of attention, and that's good. The staff takes very good care of me.
Porque mis palabras son más dulces que la miel.
On the day we visited, there was an elaborate celebration for the Feast of Our Lady of Guadalupe, which included a Catholic Mass, an outdoor procession, and mariachi music.
Vamos todos a cantar. Pues yo trabajo aquí con la doctora Pugh.
Dr. Ezequiel Casillas, medical director for AltaMed Senior Services, says taking part in a broad array of social and cultural activities is key to improving health and well-being.
The World Health Organization estimates that only 10% of a person's well-being is really impacted by medicines and medical care, whereas the social determinants of health, nutrition, where they live, poverty, environmental factors impact much more of their well-being. And when they come here, obviously they get to do the important socialization with other people and do the cognitive activities to maintain their cognitive functioning, and obviously the physical activities as well.
You said we don't eat avocados?
No, we
For 86-year-old Eva Alegria, the PACE program literally saved her life. She had lived in her own home for 60 years, but was growing more and more depressed as her health failed.
I was very depressed. I was ready to go. In fact, believe it or not, I had asked my friend that does wedding dresses. I told her how I wanted to be buried.
But her sons had other plans for her. They enrolled her in the PACE program, kicking and screaming, she says. Within weeks, though, she'd had a complete turnaround. Now she loves coming for the food, the parties, the camaraderie.
There I go.
She hopes that if she keeps exercising, she may even get out of her wheelchair to dance with the mariachis.
I told the guy up there, I said, wait a little while longer.
Patients at the center must use AltaMed physicians rather than outside doctors, which discourages some from joining. The tab for the services is picked up by Medicare or Medi-Cal, California's version of Medicaid. Still, it's expensive to start a PACE program, which may explain why there aren't more of them.
There is a lot of investment up front to get these programs started. Many of them take 4 or 5, even more years to start up with it's a multi-million-dollar investment. But I think things are changing a little bit. There's been quite a bit of interest in the past few years. There's quite a few new programs starting in California. And I think the health plans and the state are realizing that this is really the ideal program for these very frail patients who are not yet in a nursing home and who can be kept out of a nursing home with the right resources.
Californians do have other options for adult day facilities, but state funding for those programs was severely cut 3 years ago and will be at risk again next year. It's a situation that could become one of the country's biggest challenges: how to provide quality long-term care for an elderly population that is expected to double in the next 15 years.
What can you do to keep yourself happy and healthy in old age? We prepared 7 tips for successful aging, recommended by the people featured in this segment. You can read those on our rundown.